Hello everyone, welcome back to Studious Students. In this video, we'll talk about hepatitis C virus. And with that, let's begin. First and foremost, let's start with the introduction. It is commonly seen in developing countries and it is seen after post transfusion. It was first discovered in 1989 while performing experiments with chimps. Talking about the structure and the address of this virus, it belongs to the family of Flaviviridae and the genus is Hepativirus. It is spherical in structure 60 nanometer in size, and it is envelope as you can see in this image. Diving deep into the structure, the outer structure is covered with an envelope, and on the envelope we find various glycoproteins such as E1 and E2. Inside the envelope we find capsid, and inside capsid we have positive sense ssRNA. This is a simplified diagram. The circle you see is the envelope, and on the envelope we have E1 and E2 glycoproteins. Inside the envelope we find capsid, and inside capsid we have nucleic acid. Please note one membrane protein, which is known as B7, that functions as ion channel. We also have 6 non-structured proteins. The names are NS2, NS3, NS4A, NS4B, NS5A, and NS5B. This hepatitis C virus shows genetic diversity. But why? It is a big fat why. It is because of high replicative activity, which naturally leads to mutations and variations. The second reason is lack of proofreading of RNA polymerase. HCV is a RNA virus. It replicates using RNA-dependent RNA polymerase. This enzyme lacks proofreading. Errors made during RNA synthesis accumulate, which leads to mutations. There are 6 major genotypes with more than 100 subtypes. They are known as quasi species. Again, this is the structure of hepatitis C virus. We have E1 and E2 as glycoproteins. In this, E2 is more prone to undergo mutations because it is the most variable region of the entire HCV genome. So, hepatitis C is a virus. So, the body naturally forms antibodies against hepatitis C. It works at first and they form lock and key mechanism. But E2 region mutates and the lock and key mechanism fails. And the old antibodies become useless, as you can see in this image. That's how it escapes our immune system. This results in establishment of chronic infection and failure of development of effective vaccine because the E2 glycoprotein mutates fast. These points are important for the exam. Genotypes 1 and 3 are more prevalent in India. And the second point is genotype 1B responds poorly to therapy. So please make a note of it. Hepatitis C virus is transmitted through contaminated blood transfusion or organ transplants. It is also transmitted through needle stick injury. Mother to fetus transmission is also possible, and sexual transmission is rare. The incubation period of hepatitis C virus is between 15 to 160 days. 75% of the patients become asymptomatic, but they are still carriers. 20% develop acute hepatitis, and 5% clear the infection on their own. As the disease progresses, it becomes from acute hepatitis to chronic hepatitis. The complications include liver cirrhosis and hepatocellular carcinoma. Extrahepatic manifestations develop due to depositions of immune complexes and mixed chiroglobinemia, Mr. urine filled with blood, that is glomerulonephritis and arthritis. Now coming to lab diagnosis, the first one is HCV antibody detection assay. So it basically detects the antibodies. Please make a note of it. First and second generation ELISA don't work, but third generation ELISA works. It detects antibodies against core antigen NS3, NS4, and NS5. We cannot tell whether the infection is active or old from this method. The second one is HCV core antigen assay. It detects HCV core antigen, as you can see in this image. It is cheaper than PCR, but less sensitive than PCR. The third one is real-time PCR, which is the gold standard. It detects viral RNA. It is used to confirm active infection, to quantify viral load, and to detect infection during the window period. As we discussed previously, hepatitis C virus has 6 genotypes and 100 subtypes. Genotyping is used to identify the subtype and the genotype. For treatment, we use direct acting antivirus targeting NS3/4A, NS5A, and NS5B. Examples include for NS3/4A, we use grazoprevir. For NS5A, we use daclatosvir. For NS5B, we use sofosbuvir. The regimen includes combination of the previous drugs and the duration is between 12 to 24 weeks. Now coming to the prognosis factor, a good prognosis factor is IL-28BCC. Poor prognosis includes genotype 1 and 4, poor compliance, cirrhosis, and HIV co-infection, and 8 lakhs international unit per ml is considered as high viral load. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Studious Students. See you in the next video.